Avian influence, preparedness, mitigation, and response. Appeal. The International Federation mission is to improve the lives of vulnerable people by mobilizing the power of humanity. It is the world's largest humanitarian organization, and its millions of volunteers are active in over 183 countries. Looking forward, um, the International Federation mission is to improve the lives of vulnerable people by mobilizing the power of humanity. The International Federation undertakes activities that are aligned with this global agenda, which sets out for broad goals to enable the International Federation to meet the mission. First, reduce the number of deaths, injuries, and impact from disasters. Reduce the number of these illnesses and impact from disease and public health emergencies. 3. Increase local community, civil society, and Red Cross, Red Crescent capacity to address the most urgent situations of vulnerability. And 4. Reduce intolerance, discrimination, and social exclusion and promote respect for diversity and human dignity. Summary. The International Federation of Red Cross and Red Crescent Societies, the International Federation, has already started responding to avian influenza or bird flu based on approach that I and pandemic human influenza are two distinct but closely related issues, given the potential magnitude and unprecedented nature of the threat posed by avian influenza and its possible conversion into pandemic influenza with disastrous consequences. The International Federation is committed to using its competitive global advantages to support increased efforts by its member national societies to develop and implement successful measures leading to viable risk reduction in relevant nations and global response capable to and pandemic influenza. Experts at the World Health Organization and elsewhere believe that the world is now closer to another influenza pandemic than at any time since 1968, when the last of the 20th century's three pandemics occurred, and that the risk for another Spanish flu-like epidemic is considerable. Who uses a series of 6 phases of pandemic alert to inform the world of the seriousness of the tree and of the need to launch progressively more intense preparedness activities. You can see this table below. International Federation overall goal and objectives. Support national society efforts to increase their capacity working in partnership with their governments to tackle avian influenza at community or local level in affected countries, thereby mitigating the threat of pandemic and the challenges it might pose in reducing the risk of human cases. Provide resources and structural support so that countries and communities at risk of bird flu can increase their preparations for a possible pandemic and are ready to train their people, plan for and advise on service continuity at all levels of national societies, and in the International Federation Secretariat so that essential services to communities and coordination activities are assured. Maximize the disaster response experience base and provide international leadership within the Red Cross, Red Crescent movement by sharing perspective to inform global preparedness and response work. Maintain the capacity of the International Federation and its members to respond to simulations disasters by updating contiguous plans, formulating critical intervention strategies, and building up preparedness and risk reduction strategies. Increase the preparedness of national societies as the auxiliaries to their governments for a potential PI pandemic. Share knowledge as widely as possible to support the wider humanitarian and health communities. Reinforce coordination among the Red Cross, Red Crescent between agencies and with the United Nations and governments. The International Federation, Geneva, Secretariat has set up two technical bodies, Influence Steering Committee and Influenza Task Force, to continue expand and consolidate the work done so far, coordinate, support, guide, and advise members on appropriate preparedness and action, link with the mature global and national players. Slide number 9. Who currently defines five strategic actions to address a possible pandemic influenza? First, reduce human exposure to H5N1 virus strain. Strengthen early warning systems. Intensify rapid containment operation. Build capacity to cope with a possible pandemic. Coordinate global science and accelerate vaccine development and expansion of production capacity. Action by national Red Cross and Red Crescent societies. At the end of January 2006, the Public Health and Emergency Unit and the International Federation Secretariat put together a 26-question survey to identify national society progress in defining their roles in influenza response, capacity needs, training and resources needs, existing capacity, involvement in national task forces and government plans, previous experience with communicable disease prevention and control, cooperation with the government and the other players, the needs. While 70% of national societies are already considering or have started influenza preparedness actions, the result of mapping surveys show that for the majority the level of preparedness is still at an early stage. Needs therefore relate primarily to capacity building, scaling up of capacity and management, contingency planning for con- commitment, disasters, communications, and service continually planning. The proposal negotiates the partnership. The current appeal seeks funds to support work in connection with avian influenza. This includes activities related to assessment and startup of national society program, medical and non-medical materials for protection, dissemination, and health education, communications, support for national societies training, capacity building, and coordination, and for training national society staff and volunteers. National society information, hotlines for health information, the creation of guidance tools for national societies in line with best practice and WHO and FAO standards, beginning the pandemic preparedness work such as services continually and contingency planning in coordination with the forthcoming UN government and interagency plans. Challenges: health, sanitation, particularly at the level of health institutions in developing countries. Capacity of health systems in developed countries with safety regulations that are, that are too stringent. Hospitals will be closed for non-pandemic influenza patients. Socio-economic problems in transferring money, breakdown of supply chains for all commodities, return to cash, barter, or other traditional payment practices. Communications, public transport problems, fuel, human resources, breakdown of planning, air transport problems, travel restrictions, media and reporting information flow problems. Thanks for your attention.